You're listening to an African Elements top news story for July 23, 2025. Please visit our website at africanelements.org for more daily news. On July 4, 2025, President Trump signed the One Big Beautiful Bill Act, OBBA, into law, which includes nearly $1 trillion in cuts to healthcare programs over the next decade. More than $900 billion of these reductions target Medicaid funding. The Congressional Budget Office, CBO, estimates that these cuts could lead to 11.8 million Americans losing their health insurance. The OBBA also proposes significant cuts to Affordable Care Act, ACA, marketplace subsidies, totaling $268 billion, and delays or prohibits the implementation of several final rules related to Medicaid and Medicare. It bans federal Medicaid and CHIP funding for gender transition procedures and certain reproductive healthcare providers, amends Medicaid provider tax requirements, and delays allotment reductions for Medicaid disproportionate share hospitals. Medicaid is a joint federal and state program that provides health coverage to millions of low-income Americans, including children, pregnant women, parents, seniors, and individuals with disabilities. Eligibility varies by state and generally depends on income relative to the federal poverty level. The OBBA's proposed cuts to federal Medicaid funding will significantly impact this partnership, potentially leading states to scale back or eliminate optional Medicaid benefits. Federal matching funds are crucial for Medicaid financing, and the OBBA's cuts will reduce these funds and prohibit new provider taxes, limiting states' ability to generate revenue for their healthcare programs. Work requirements in Medicaid mandate beneficiaries to engage in work or community service to maintain coverage. The OBBA introduces new community engagement requirements, increasing administrative burdens for states and potentially causing churn among beneficiaries. This could lead to an estimated 7.8 million more uninsured people due to increased hurdles and funding limits. Many beneficiaries may face new co-payments of up to $35, making them less likely to seek care. Health insurance marketplaces allow individuals and small businesses to enroll in health insurance plans. The OBBA's cuts to ACA marketplace subsidies could lead to premium increases, driving higher rates of beneficiary churn and destabilizing risk pools. States may struggle to fund Medicaid due to limited taxes on medical providers, potentially leading to reduced enrollment or benefits for low-income Americans. Social determinants of health, SDOH, significantly influence health outcomes. The OBBA's cuts to Medicaid could worsen access to health services, widening health disparities. Vulnerable populations may lose access to crucial health services, increasing mortality rates. Research indicates that reducing Medicaid coverage leads to poorer health outcomes. Systemic discrimination and racism exacerbate these disparities, particularly affecting Black and American Indian Alaska Native populations. Healthcare disparities are differences in health outcomes linked to social, economic, or environmental disadvantages. The OBBA's cuts to Medicaid and ACA subsidies are expected to increase the number of uninsured patients and exacerbate existing disparities. Black and American Indian Alaska Native populations rely heavily on Medicaid and could face reduced access to essential services due to cuts. The impact on state budgets will be significant, especially for the 40 states and Washington, D.C. that expanded Medicaid, expecting reductions in federal spending between 10 and 21%. States will face tough decisions on how to account for funding reductions with limited options for new revenue. The OBBA could lead to states scaling back or eliminating optional Medicaid benefits, increasing the number of uninsured patients, and placing a heavy burden on hospitals and providers. The prohibition of new provider taxes and reductions in allowable thresholds further limit states' ability to support their healthcare programs, putting immense pressure on state budgets and potentially leading to cuts in services. Copyright African Elements.